everyone. Welcome to another expert interview from Enomed Solutions. Today we're going to talk about zoonotic diseases. You may have heard the term zoonotic diseases, but maybe you're not quite sure what that means. And so we're very lucky to have with us today Dr. Geert Paes, who is a European specialist in internal medicine. She also does online consulting in internal medicine and is also a veterinary continuing education professor through her company Online Vet Training. Dr. Paes has a special interest in zoonotic infections, and so is going to answer some of our questions today about what zoonotic infections are and how we can protect ourselves from them. So, Dr. Paes, welcome.
Thank you. Thank you for
Thank you so much for being here today. So let's get started. So what is a zoonotic infection?
Well, that's a difficult term, but I think probably everyone has heard of it at one point. But what a zoonotic infection is it's actually an infection that can spread from animals to people, but also from people to animals. And there's many different infections. It can be bacteria, it can be viruses, it can be parasitic infections. Some of these infections will result in very mild clinical disease. If we, for example, think of a parasite like a tapeworm that can transmit from a dog to a human, it's often very benign and not very severe, the illness that it will cause. But some of these infections can be really pretty severe and some of them even fatal. If we think, for example, of rabies that we can get mostly from contact with wild animals in people, when we would get the infection and we wouldn't get treated, it's actually 100% fatal. So some of these infections are definitely better known than others and definitely more severe than others. And it's at this moment, it's actually believed that out of 10 infectious diseases in people, 6 of them actually come from animals, and that of the new emerging infectious diseases, 3 out of 4 actually come from animals. So it's not very uncommon to have infections that can cause disease both in humans and in animals, and that's exactly what zoonotic infections are.
Right. So are there some examples of recent infections that we faced that are zoonotic?
Well, I think we can immediately think of COVID. I think people that are following the news have also seen that now last week, a couple of lions in a zoo in India actually got really sick from COVID, and that one lion actually has died from it. So in this infection, it's more the people that get really sick from it, and the animals seem to be fairly resistant to it. They can get the infection, but we don't see, as veterinarians, we don't see a lot of COVID infections in dogs and cats, but it clearly is an infection that can also go from people to animals, and so it's a perfect example of a zoonotic infection.
Yeah, and I just want to go back to rabies. Here in Europe, rabies was considered eradicated at one point, and I think it's still in the minds of many considered eradicated, but with the anti-vax movement, people not vaccinating as much as they were before, and with a lot of black market pets coming in from countries where rabies is not eradicated, we're seeing more rabies in Europe.
Absolutely. And on top of that, we also see more world travel, right? In the last years, people travel more often. And I remember a couple of months ago or a year ago in Belgium on the news, that little cat, I forgot the name now, Lee, I think it was little cat Lee, that was imported from Peru. People that went traveling to Peru, they found a pretty little stray cat, they took it home. But it's by all that world travel, and indeed by puppies being imported from countries where there is actually still rabies. And then on top of that, not vaccinating, that we actually see these infections more commonly again. And as I said, with rabies, it's not a disease to actually joke about.
No.
It's really very severe, and when you don't get treatment immediately, it's 100% fatal. So some of these infections are definitely known because of that, but there's many in between, right? There is still a lot of them that might not immediately be fatal, but that can still make us very, very ill.
Yeah.
And I am very passionate about talking about this subject, because I do think that human medicine is not fully 100% aware yet of all these infections that we see in animals that can actually also cause diseases in people. And so I really do think that there is a big big room for improvement for veterinarians and human doctors to work together to actually get more and more information on these infections.
Yeah, I mean, we'll talk about the One Health movement a little bit later in the interview, but that's really where we're going. One Health, so One Health for all,
Absolutely.
living, breathing, beings on the planet. And again, One Health is, we're talking about viral infections, bacterial infections, parasitic infections, all kinds of different types of infections. And so how can we then, how would a person acquire a zoonotic infection from an animal?
Well, there are several ways, right? First of all, we can subtract it from eating food that's contaminated, and I think that's probably amongst people the most known way. Yeah, we can get, for example, bacterial infections like Salmonella or Campylobacter. If we think, for example, of a chicken that hasn't been cooked properly, or food that has gone bad, meat that has gone bad, or that has been out of the refrigerator, it can really carry certain infections. But also vegetables, for example, vegetables that aren't properly washed, they can carry toxoplasmosis, which can be a risk for especially pregnant women. So we can get it through our food, but then of course we can also get it through direct contact with animals, and that can even be with our pets, dogs and cats. So it's not only wild animals that can carry scary infections, but also our pet dogs and cats can carry them. And some of these are, like I said previously, a parasitic infection like tapeworm or Giardia. These are very benign. Okay, we can also get a bit of a gastrointestinal upset from it, but in general, they don't make us super sick. But there is a couple of other infections that can really make our dogs and our cats sick, but also we ourselves can get sick from it. And one of the examples that most veterinarians know really well is leptospirosis. It's a bacteria that's mostly being transmitted by contaminated rat urine. So dogs that come in contact with water that has been contaminated with the urine from rats that carry the bacteria, they can get infected like that. Dogs can get vaccinated for it. Unfortunately for this disease, vaccination doesn't give 100% protection because there's multiple strains and the vaccination doesn't cover all those strains. We also know that with COVID, the different strains that can exist with specific infections. So with leptospirosis, some of the dogs still will get really sick and they can really develop acute kidney failure. But we as people, and especially the people that live closely to them, or closely with them, or the ones that treat them, the veterinarians, if we come in contact with the urine from an infected dog, we can also get really sick ourselves. And another example is, for example, Bartonella, and we will also talk a little bit more about that later, but also in a bacterial infection better known for causing cat scratch disease, that often our pet cats, they will carry it without showing any signs, so they don't get really sick from it themselves. But if we get scratched by the cat or we get bitten by the fleas potentially that carry the bacteria, we can get sick from it. And that can be a fairly self-limiting disease, but it can also be more chronic and more severe. So direct contact with our animals is definitely also a way that we can get infected. And then the third way is by contact with certain insects. We know the crawling animals. Ticks are very known for it, but also spiders, certain flies, mosquitoes. If we think of mosquitoes, what they can transmit to people, it's also fairly extensive, the amount of infections that they can carry. And so as people, we can also get infected by a tick bite. And these ticks, they can carry bacteria that don't only make our dogs sick, but we can also get sick from them. So there is definitely several different ways by which we can come in contact with these infections.
Yeah, and so some examples I can think of, from the tick bites, for example, everyone knows about Lyme disease, right?
Yeah, so that's the best known one.
That's the best known one, right? And I was thinking also about foodborne diseases, especially here in Europe. The one that really caused a lot of problems was the mad cow disease.
Absolutely. Yeah. That was 20 years. I don't know how long it was. I was still a little child, but it was something that was really all over the news. And exactly, that's also a perfect example of a zoonotic infection.
Yeah.
Yeah.
And so let's get back then to One Health. So we're talking about diseases that can be transmitted between animals and humans. What is this One Health movement, and what is it all about, and how does it work?
Yeah, so the One Health movement was started in 2009, so approximately 12 years ago in North America, and it works closely together with the CDC, which is the Center for Disease Control in North America. And One Health recognizes that the health of people is very closely related to the health of animals and the environment that we share. And over the last decades, we've talked about world travel already. World travel has been expanding or has given certain infections the possibility to expand from one country to the other. Also, look at what happened with COVID. If people wouldn't have traveled, it probably would not have spread out so much. But on top of that, we also see that there is global warming. The temperatures are going up, so we have now infections that in the past could only survive in more tropical climates that are now actually also capable of surviving in climates that are more temperate. And in the last 10 years, we've seen infections in dogs and cats that have never been outside of Belgium that we didn't see 20 years ago. 20 years ago, we would only see it if they would have traveled to a southern country. But at this moment, for many infections, that's not necessary anymore. They also do arise in countries where it's actually not that tropical. And then the third thing is overpopulation. We're with more and more people on this world, and we're living closer together, but also closer to the environment. We're kind of the border between nature and where we as people live. It's very, very close. So there is a lot of close contact between us and our environment, and that makes those infections also more capable of jumping from one to the other. And I think with COVID, it's also again the perfect proof of how close contact can really benefit certain infections, and they thrive off of the closeness of people to each other. And so with One Health, it's really the intention to try to have veterinarians and human doctors work together, veterinarians with their knowledge of veterinary medicine, human doctors with their knowledge of human medicine, work together with the one goal to try to get more knowledge about zoonotic infections, to try to prevent them, to try to treat them. That's basically the thought behind the One Health movement. And I think it's beautiful because I really do think it's all very closely intermingled with each other. And I don't think it's a good idea to only know something about the part animals and only something about the part humans. I really do think it all works together. And the more knowledge we can share with each other, the more everyone will benefit from it.
Yeah, absolutely. And so, I mean, One Health isn't a brand new movement. It's been going on for a while, but I think that in the last maybe couple of years, it's gaining a little bit more momentum, which is good. And I think that in vet schools, we're probably talking about that kind of thing more, and in med schools as well. So we're not quite so segregated, and we're working to solve solutions for all the living species of this planet Earth, right?
To get there together, to reach the hand and do it together.
Exactly. I just wanted to mention one thing when you were talking about global warming that is kind of a hot button issue for me, and that is heartworm infection. In Europe, especially in Northern Europe, we've been used to not recommending heartworm prevention for dogs or cats. Cats can get heartworms too, and it's transmitted by a mosquito bite because we aren't used to having a lot of mosquitoes or mosquitoes that can get infected, and usually the winter would wipe out all of the mosquitoes, and we didn't have to worry about it. Same for fleas and ticks. Winters used to be hard enough to wipe out these pests, and now of course with more people traveling with their pets to the south, but also with global warming, heartworm disease is something we need to think about even in Northern Europe. So that's kind of a hot button issue I'd like to point out.
Absolutely. And I think to top that off is last week my brother contacted me that here in Belgium they found mosquitoes infected with West Nile virus. And dengue fever has also been discovered already in mosquitoes in the Netherlands. And these are infections that in the past we would only think it's like Southeast Asia, Africa. but they are actually occurring now in Belgium, in the Netherlands. So yes, these infections, they don't have borders anymore. They can survive because it's what you say, the winters, they're not tough enough anymore to wipe these insects out. And so it's becoming more and more of a problem. And I am afraid that we will hear more and more of these infections causing more and more trouble for people.
For a lot of these insect vectors, so where the insect carries the infection, I think that it's just everyone should be aware that parasite control is something that is becoming extremely, extremely important, not just for ourselves, with mosquito spray, but for our pets. It's parasite protection all year round. There's no season when you can stop your flea and tick treatment.
No. And that's 100% right. There is literally year-round need for flea and tick prevention. And that's not just a sales talk from the veterinarian, because I'm not selling it. I'm not selling any of the product. I'm not getting anything for this, but 100%. And I have 2 indoor cats, and people often say, but yeah, they're indoor, but they're still out on the patio, and I'm still going outside. So even in the indoor cats, I highly recommend just year-round. I do it with my cats, and I really recommend it to everyone, year-round insect control, 100% for sure.
Well, I think what people don't realize is that when we walk in and out, we can bring eggs and larvae in on our shoes. And then those eggs and larvae will hatch and get on your pet. So even an indoor pet isn't immune. Anyway, we're kind of getting off topic, but it's something that's important for me to mention. So Dr. Paes, you just created recently an online course specifically on Bartonella infection, Bartonellosis. Can you tell us why you did that and why this particular zoonotic infection is so important for you?
Yeah, well, Bartonella is, for me, it's a bacteria that it almost gives me goosebumps when I start talking about it, because it's a bacteria that I started to hear about when I was in my residency, when I was doing my training, internal medicine training. And at that moment, Bartonella started to become a topic, an infectious disease that we should know about. But it was still, it's really not an infectious disease that we know a lot about for many, many, many years. But it started, and in the last 20 years, more and more studies have come out about Bartonella, and it's unfortunately a bacteria in comparison with Lyme, with Borrelia, the bacteria that causes Lyme disease. Everyone knows that, but Bartonella is really a bacteria that even a lot of veterinarians, they might have heard of it, but they don't really know how this infection can present itself. And so that's why I really wanted to put Bartonella in the spotlight, because I think it's an infection that's really under-recognized, that can cause really severe problems. And just to give an example, the problems that we can see with Bartonella are not only in our animals, and mostly dogs get really sick from it, but also in people. We see now that there is more and more studies coming out showing what the consequences of a Bartonella infection can be for people. And it can really go from acute illness, infection of the heart valves has been reported both in human medicine as well as in dogs. It can cause fever of unknown origin, acute encephalitis, so an inflammation of the brain can occur in people, especially in children, but also in dogs. But it can also cause a chronic neurologic condition, chronic neuropsychiatric illness. It has many different phases, many different disease presentations. And in the last years, with having consulted, or many veterinarians consulting me about cases, it really became clear that it's not an infection that's on the radar at all. And so in the last years, I've had a lot of dogs that I said, this dog needs to be tested for Bartonella. Dogs with fever, with polyarthritis, so painful joints, difficulties walking, dogs with nose bleeding, that actually had Bartonella. And when we treated them for Bartonella, the dogs got better. But the vet didn't think about Bartonella because it was not a disease that they really knew very well. Right. And because it can transmit to people, and because a lot of our pet cats carry Bartonella without showing signs, and it's shown that people that work closely with animals and live closely with animals, they're at higher risk for getting an infection. I find it really important that this is an infection that needs to be put in the spotlight. There is many other infections that are equally important, but with my training, I really wanted to put Bartonella in the spotlight because I really am 100% convinced that a lot of the diseases in dogs and in people caused by Bartonella are not recognized yet, and therefore there is unnecessary suffering because treatment is being postponed because the infection is not being picked up. So that's why I specifically chose that bacteria.
And how is Bartonella transmitted?
Well, Bartonella originally was only thought to be transmitted by cat scratches. So when a cat scratches you and a cat is infected with Bartonella, and most cats get infected by fleas, and that's also why it's so important to have that flea prevention year-round, because it's mostly the cat who gets it from the fleas. So that was originally thought that was the most important way of transmitting the infection, by being scratched by an infected cat. But now it's clear that there's also many vectors, many insects that can carry and transmit it, such as ticks, spiders, mosquitoes, flies. So a lot of biting interests can also give it. And there is also some thought, this is not proven yet, that bites from dogs that carry it in their saliva can also transmit the infection. There's been a couple of cases in China where this was the way of transmitting the infection. So it can be either directly through contact with our cats by being scratched, and this is something that veterinarians for sure are at higher risk of, and this is also why it's a disease that's most commonly seen in people that actually work with animals. But we can also get it from the insects that actually feed off of the animals.
And so I know you, and so I know that you particularly have a history with this disease. Can you tell us a little bit about your personal experience with Bartonella?
Yeah, so what drove me into Bartonella is actually a couple of years ago. I got really sick myself in 2017. I got sick myself, and I got really sick. I was wheelchair bound and bedridden for well over half a year. And it all started very acutely. I was traveling in Borneo. I had contact with many, like, I'm the type of person, when I see a stray cat, I take it, I cuddle with it. I have my son cuddle with it because, yeah, it's sad, so you have to cuddle it. I also got bitten by a lot of insects because we were in the jungle, and I acutely got ill at the end of our trip in Borneo, and I developed attacks of paralysis. I would get paralyzed over my whole body, and long story short, people who are interested in the story, I would definitely refer to my training. But after a long process, and after having undergone many testings, it became clear that it was not really clear what I had. The doctors, the neurologists that I consulted, they were at a certain point at wit's end, and they kind of concluded it must be a mental problem. And I was originally completely on board with that. I was like, yeah, it had been a couple of rough years. You know, I did my board exams. I had a child. I mean, yes, I was a little bit tired. So I was like, okay, that definitely could be the thing. Perhaps this is just a weird presentation of a burnout. So I took control. I went to a psychiatrist, and we started on medication, and we did everything we could to actually try to sort out what might be causing the illness. But after a couple of months, I mentally was feeling really well, but physically I was still really sick. And it's at that point that my psychologist said, I don't think there is anything there anymore. It does seem to be more physical at this moment. But we were at a stop. The doctor was like, I don't know what we can do further. And that's the time that I actually started searching myself and came in contact with infectious disease specialists, both human and veterinary. And we started actually going on the path of this could be a Bartonella infection. Now, eventually I was tested for a whole bunch of infections, and I did come back positive for a couple of zoonotic infections. Bartonella actually was not one of them. And the difficult thing in my story is that the infectious disease specialists still thought it could be Bartonella, because it's an infection that we know is very difficult to diagnose. Anyways, I was started on treatment for various infectious diseases, amongst amongst them Bartonella. And within 3 months of treatment, I was out of the wheelchair. I was okay again. Not 100%. I'm still not 100%, and I don't think I will ever be 100%. But for me, the antibiotics eventually gave me my life back. And that's became for me a reason to look further into these zoonotic infections and into thinking that we, especially as veterinarians that work so closely with animals, and we are so uncareful about that. We take blood and we get bitten and we get scratched and whatever. We quickly clean it off and up to the next patients, and we love our patients so much that we're so close and so intimate with them, if you can say that. That I find it really important to really spread the message to veterinarians and people in general that we have to be careful. We have to be careful because we can get sick from some of these infections, and they can make us really, really sick. And that's why I felt like I need to make a training about I'm going to pick Bartonella specifically, but we're also addressing a couple of other infections. But I'm going to make a training about this and offer it to whoever wants to see it for free, just purely because I really do think that we sometimes are not aware enough of how careful we should be when it comes to these zoonotic infections. I'm not saying we should become paranoid or anything like that, but I do think that sometimes we should be a little bit more careful, take more measures to prevent us from getting infected. And yeah.
Well, I have two questions for you. One's going back to the diagnosis and that you were diagnosed negative. Just so people understand, it doesn't mean for certain types of infections, just because it's negative doesn't mean it's negative, and that's often because sometimes we're testing for antibodies, sometimes we're testing for levels of the organism, and sometimes, your immune system actually, can hide an infection. And so you take the blood and it shows up negative. And if you took it, a couple of hours later or a day later, the result might have been positive. So that's sort of one technical thing that veterinarians and doctors need to know about testing for certain diseases. The other thing I wanted to ask you is, and we'll put the link in the final screen of this interview so that people can see the link. But where can people go to find a link to this training on Bartonella?
So they can just go to my website, which is just www.onlinevettraining.com, and the training is free for everyone who wants to see it, and I find it important that as many people see it. It's a long training, so I am going to warn you, because it's both about veterinary medicine, Bartonella, human medicine, Bartonella, and then the story of me, and I also share the story of my son, which is a completely different story than my story, but also really, really shows the importance of being aware of zoonotic infections, testing for zoonotic infections more frequently, and treating for them. So I think it's two stories that really show that it's not a black and white situation. It's all more complex than just doing one test and you know what it is, and now we know what to do. It's definitely not that black and white. But what I do think our stories really show is that there is room for growth. There is room for becoming more aware of what these infections can cause, testing more frequently for them, figuring out what tests might be more reliable. So also doing research and getting more reliable testings, and also more successful treatments. So that's what I wanted to reach with this training.
Yeah, and I'll echo that, because I think that a lot of us might have chronic problems that we've seen a bunch of doctors, we've gone to a bunch of different types of therapists, or have tried parallel medicine, have tried different types of drugs to get rid of whatever symptoms that we're feeling, and it doesn't work. And most of the time, when you're complaining about something that traditional medicine can't fix, people tell you it's all in your head, there's something psychological going on. And so I'd like to say to those people, find a doctor who will push further and who will do, who will think outside the box and do more tests, because there's a lot out there that we sometimes don't think about. testing for, and that your problems may be resolved just by having a doctor that does a little bit more testing and digs deeper.
And
yeah.
I think that's the other thing that I wanted to reach with my training, and it's actually really interesting because it only has been online for a couple of weeks now, and I've actually been contacted by several people that have chronic illness, a couple of veterinarians that are if you read what they have, if they tell me their symptoms, never at any point did anyone think about an infectious disease, and these people are now finally going further to actually get tested for infectious diseases. And really, if you look at the literature of veterinarians with some of these infections, it's horrific. It's out there. It does exist, but unfortunately there is still doctors out there that really do not believe in it. I don't think this is even a thing to believe about, but they just don't believe in it. And so with my training, I also really wanted to give hope to the people that are chronically ill, like keep searching, don't give up, because you yourself, you know yourself better than anyone.
Yeah.
So don't get brushed off, or don't give up. Keep searching and keep going for doctors that actually do believe you and that want to continue with you.
Yeah. Keeping in mind, as you said before, that a lot of these zoonotic diseases do affect the brain. Whether it's a virus or a parasite or a bacterium, they can affect the brain. So sometimes psychological or psychiatric problems can have an infectious origin. So this is the kind of thing that you need to speak openly with your doctor about. Don't be afraid to confront your doctor with information and ask the right questions. It's their job to dig deeper. Every doctor doesn't know everything, and that's normal. But if you bring information to your doctor, then they should follow up on that with you or send you to a specialist. So
yeah. That's 100% correct. And it is, you cannot diagnose what you don't know. And that's totally fine. You don't have to know it all. But I do think it's important for doctors, for veterinarians, to always keep having an open mind. And it's not because you don't know it that it doesn't exist. That's I think the most important thing to remember. You might not know it, but that doesn't mean that it doesn't exist.
Yeah, absolutely. So now that we're all scared to death of zoonotic diseases, obviously we want to protect ourselves, and as veterinarians, it's true. You're right. We feel like we're untouchable because we're in it all, up to our elbows, and but we are vulnerable, and so is everyone else. So what can we do as humans to try and protect ourselves and protect our pets also from zoonotic infections?
Well, first of all, I want to say there is absolutely no reason to become completely paranoid. We love our animals, and we should love our animals, and we should cuddle our animals. And if our animals lick us, that's totally fine. But we should take a couple of just common sense precautions, such as when you have pet your animal and you're going to eat something, wash your hands. When your dog has licked you in the face, just wash it. With young children, they do get worms also, and they often live very, very closely with your pets. And there's nothing wrong with a couple of worms, but just use your common sense. When they get licked or whatever, just wash it off and just be careful that way.
I'm just going to interrupt you real quick right there on the subject of worms, because I think people really don't realize that the common intestinal worms that we treat our pets for, a lot of them can infect us, and they will especially infect our children. And so not only, a lot of people let their dogs lick them in the mouth. It's something that a lot of people do, and it's, it's a sign of affection, and people feel close to their pets when they do that. But it is not safe to let a dog lick you in the mouth, or especially a child in the mouth. Even though it's cute and endearing, it isn't safe because you can get their parasites that way. And let's not forget about sandboxes and playgrounds, because stray cats will defecate in these areas, and then that's how children can come into contact, and then they put their hands in their mouth. So just be not paranoid, but vigilant, and hand washing is something we want to think about more.
And something easy to do. And I think also with COVID, hopefully everyone, became more, acquainted with just regularly washing your hands. And it's an easy way to prevent a whole lot of things. Now, on top of that, of course, when you get bitten by a dog or a cat, or you get scratched, just even a scratch, disinfect it immediately. I just make a habit of disinfecting it immediately. I mean, things can happen. Your cats don't have to be vicious. My cats, I get scratches all the time just because they're trying to climb on me or whatever. Just disinfect it immediately. And then when it comes to food, of course, our food is also something that we have to be careful with, especially when the temperatures rise and we do barbecues and meat is standing out for a little while. Just make sure that your meat is really thoroughly cooked, that vegetables are washed, and that things that are expired or that has been sitting out for a long time, eggs, for example, or mayonnaise, just throw it away. Don't eat from it anymore. And then I think the last one that's really important, and it's might not be as important for everyone. People that live in the cities might never come in contact with it, but people that live where I live, we see ticks on a weekly basis. Like, you really need to protect yourselves from these insects. Also, use tick repellent socks on top of your on top of long trousers. Use long trousers also for your shirt. Check yourself after you've been in the woods or in the forest. Check yourself for ticks. Remove them immediately if you have them. Also check your kids. Kids that go to camps. I often think, like, no one is checking these kids for ticks. Tell the guides, the people that are responsible, like, please just make the kids check themselves in the evening to make sure that they don't have ticks. Because if they keep sucking, the longer they suck, the higher the risk for transmitting infections. Exactly. And the same with mosquitoes. Use mosquito repellent, use a mosquito net, or anything you can do to try to avoid insect bites as much as possible. Because think of West Nile virus, dengue fever. We don't have to travel to Thailand anymore. It's not that it's super common here, but I mean, why take the chance if we can protect ourselves from it?
Yeah, and just getting back to the subject of ticks, when you're walking in the forest under trees, ticks will just fall from the trees and end up in your hair, and so and they will go to warm places where they're hidden. So you're not going to see a tick in the middle of your forehead. It's going to be hidden somewhere, behind your ears and your hair. And then, of course, tall grasses are also a great place for ticks. And so when you go for a walk with your dog, check between the toes, check inside the ears, check, under all the folds. Do a thorough check every single time you walk your dog in a field or in the woods. If a tick is anything but flat, completely flat, that means that it has fed. So if it's starting to balloon up, it has fed. And that is where the risk, as Dr. Paes said, of transmission of disease is the highest, is when the tick has fed. So, thank you so much for all of this insight. I don't know if you have any sort of closing comments you'd like to make before we conclude our interview.
I don't have any closing comments other than just be safe. Everyone, people, veterinarians are also people, but just be safe and just take care of yourself.
Well, thank you so much. We're going to, at the very end here, we're going to give you the website address for online vet training, and also specifically for the Bartonella training for anyone who's interested. And I hope that this was useful for the people who are watching us today. And I look forward to seeing you again, Dr. Paes. We always appreciate having you with us. And I'll say good evening to you and to the people who are watching us here today.